given what we do, technology is a really important part of that. For example, we use a CAT scan. Okay, why would a dental office have a CAT scan? Well, we use it for a lot of different reasons. One is I treat a lot of head and neck pain, and we look at jaw joints. It's the best way, in fact, it is now the standard of care for looking at jaw joints. Why would I look at jaw joints? Well, when I see a person's jaw position relative to what their joints are doing, when I see their jaw joints pushed way back toward their ears, their jaws shoved way back, their bites real short, and they're functioning in a position which I know is uncomfortable for their muscles, it helps me diagnose that information. We place implants utilizing a CAT scan, so we can look and see where the bone is relative to where the teeth need to be, and we can figure out exactly where to place the implant, and very quickly can determine, is this person a candidate for an implant or not, and also we can determine where's the best location for that implant. We look for cysts, tumors, all the different stuff that you can look at with a CAT scan, and figure out, are there issues that the person could be having that we need to diagnose and get further evaluation, perhaps by an oral surgeon or an ENT or somebody to make sure that the patient's getting the best care. We can also look at airway. When you look at a CAT scan, you can determine where the tongue position is, and we can figure out how much space is there for air to flow into the lungs. And then we can look and determine, is this person a potential person who could have obstructive sleep apnea and problems that way. And then we can also utilize appliances to help the jaw be brought forward and open up the airway, and we can see what kind of airway changes occur when we actually utilize those appliances. So there's a lot of stuff we can do with a CAT scan. We use soft tissue lasers. We can reshape gum tissue. We can make the teeth look prettier because the gums are in the right locations, that kind of stuff. We use a K7 computer. It's a device that allows us to track jaw position and also look at what the muscles are doing and figure out where the bite's the most comfortable. And then we can fine-tune the bite in that position and make the patient's muscles calm down and make their pain go away. So there's just tons of digital x-rays, tons of different things that we do utilizing technology, and it's amazing the capabilities that the stuff we have. So dentistry today is technology. The secret is making the technology work for you and not being the technology. So we like to be personalities too, and take good care of our patients so that they feel like they're part of our family.